Hi, this is Cushing Hu doing my final video presentation. The disease I have chosen to talk about today is iron deficiency anemia. Iron deficiency anemia is a specific form of anemia, and anemia itself is defined as a deficiency of red blood cells or a deficiency in the level of hemoglobin in the body. It causes impaired oxygen carrying capacity, and it can be caused by many different things, such as impaired production of the red blood cells and excessive blood loss. Iron deficiency anemia is a specific type of anemia, and it also shows up with diminished red blood cell levels like many other types of anemia. However, it is specifically caused by dietary deficiency of iron, loss of iron because of excessive bleeding, or increased demands of iron. Iron deficiency anemia is classified by a decreased number of red blood cells, and also the red blood cells are microcytic and hypochromic. So hypochromic is whenever the red blood cells are paler than normal, and microcytic is whenever the red blood cells are smaller than average. So you can use a peripheral blood smear to show the microcytic red blood cells, and the red blood cells will present themselves as being smaller than average. You can use this peripheral blood smear to help differentiate between the different types of anemia, like versus vitamin B12 deficiency anemia, and you can also use this as a diagnostic test to diagnose for iron deficiency anemia as well. Iron deficiency anemia can also present with polypocytosis, which is whenever the red blood cells have a variation in shape, and also anisocytosis, which is whenever the size of the red blood cells are unequal. Iron deficiency anemia is also classified with low hemoglobin and low hematocrit, a decrease of iron stores, and also low serum iron and low ferritin characterize iron deficiency anemia. Iron deficiency anemia falls into the anemic syndrome, and which is a part of the hematopoietic system. There are many, the etiology of iron deficiency anemia can fall into many different things. It can be caused by a deficiency of iron, a loss of iron through bleeding, or increased demands of iron as well. Most of the causes of iron deficiency anemia are centered around iron, and this is important because iron is a major component of this type of heme. So if there's a deficiency of heme, it causes a decrease of hemoglobin synthesis, which then impairs oxygen delivery. This impairment of oxygen delivery causes many of the symptoms of iron deficiency anemia and many other different types of anemia as well. Whenever iron is broken down and used, it is actually released and reused to make even more red blood cells. However, even though it is reused, a small amount of iron are lost in the feces, and this small amount that is lost is what needs to be replenished and replaced by the diet. Most iron is derived from meat, and that is why vegetarians and vegans are at risk for iron deficiency anemia. The most common reason of iron deficiency anemia in the adults in the Western world is actually by chronic blood loss, because the iron can't be recycled in the blood. So this blood loss can be caused by many different types of things, such as GI bleeding because of a peptic ulcer, intestinal polyps, vascular lesions, hemorrhoids, and even cancer. There are many different populations that are at high risk for iron deficiency anemia, like vegetarians and vegans, like I mentioned earlier. Another high-risk population would be pregnant women, because pregnancy actually increases the demands for iron. So you need more iron whenever you become pregnant, and also developing children require more iron as well to grow and develop. So developing children are at risk for iron deficiency anemia as well. There are many different clinical manifestations of iron deficiency anemia, and most are related to the impaired oxygen transport and the lack of hemoglobin in the body. Iron deficiency anemia, the clinical manifestations, a lot of it do depend on the severity of the anemia and the level of the deficiency, but Iron deficiency anemia can present with fatigability, palpitations, dyspnea, angina, and tachycardia. Epithelial atrophy can even be common, and this will result in waxy, pale or brittle hair and nails, and it can even cause a spoon-shaped deformity of the fingernails, which is known as coeliaconchia. It can also show up with a smooth tongue or sores in the corner of the mouth. It can also present with dysphagia and a decrease in acid secretion. Many people also report phagophagia, which is whenever there is a big urge to chew ice. So, to diagnose an iron deficiency anemia, you should get some blood tests and also test for levels of serum ferritin, total iron binding capacity, or transferrin. So the most important test for iron deficiency anemia is testing for hemoglobin, hematocrit, MCV, ferritin, serum level iron, transferrin, and iron saturation. So iron deficiency anemia will present with low hemoglobin, low hematocrit, low mean cellular volume, low ferritin, low serum iron, low iron saturation, but it will show up with high transferrin or total iron binding capacity. Like I mentioned earlier, iron deficiency anemia will also present itself with decreased number of red blood cells, and the red blood cells will be microcytic and hypochromic. So to treat iron deficiency anemia, a common source of treatment would be to supplement with iron. So this can be through the diet, like eating more meat, eating iron-fortified formulas like iron-fortified cereals, avoiding large amounts of cow milk, especially in infants. Also, you can supplement with medication like taking ferrous sulfate. Also, for patients who don't absorb iron very well in the GI tract or have a severe iron deficiency or chronic blood loss, or they don't tolerate oral iron very well, you can actually inject iron intravenously. There are complications of the iron deficiency if left untreated. There can be heart problems, as the heart has to work even harder to move oxygen-rich blood throughout the body. This can lead to arrhythmias, heart murmurs, and even potentially heart failure. It can also increase the risk of infections, as iron deficiency anemia can affect the immune system. It can result in motor or cognitive developmental delays in children. It can cause depression. Iron deficiency anemia complications in pregnant women can lead to a premature baby or even birth of a low-weight baby. In people with chronic conditions, iron deficiency anemia can make the condition worse, or it can result in treatments not working as well as it could. So there are many different types of anemias, and a specific differential diagnosis that could be made is a type of megaloblastic anemia called vitamin B12 anemia. So megaloblastic anemias are caused by impaired DNA synthesis that causes enlarged red blood cells, and it has a high MCV as well because of impaired maturation and division. So vitamin B12 deficiency and folic acid deficiency are the most common conditions associated with the megaloblastic anemias, and specifically a differential diagnosis for iron deficiency anemia would be vitamin B12 deficiency anemia. So B12 is actually a cofactor for DNA synthesis and nuclear maturation, and this leads to normal red blood cell maturation and division. So a deficiency in red blood cells would actually lead to abnormal red blood cells maturation, and B12 is actually found in foods of animal origin as well. This is very similar to iron deficiency anemia, so both vegans and vegetarians are at high risk for iron deficiency anemia and vitamin B12 deficiency anemia as well. So a specific type of vitamin B12 anemia is caused by atrophic gastritis. This is known as pernicious anemia, and caused by atrophic gastritis, and it's can lead to a failure to produce the intrinsic factor that leads to failure to absorb vitamin B12. Other types of vitamin B12 can be caused by gastrectomy, ileal resection, inflammation, or neoplasms of the terminal ileum, and malabsorption syndromes. The hallmark of vitamin B12 deficiency is actually abnormally large red blood cells. This can be used to differentiate between iron deficiency anemia and vitamin B12 deficiency anemia, because iron deficiency anemia will present with microcytic or smaller than average red blood cells, whereas vitamin B12 deficiency anemia will present itself with larger than average red blood cells. Like I mentioned earlier, iron deficiency anemia will be microcytic and hypochromic red blood cells as well. To diagnose vitamin B12 deficiency anemia, it will present itself with abnormally low vitamin B12 serum levels, and you can use the Schilling test to measure the absorption of B12. This will be very different from iron deficiency anemia, as iron deficiency anemia will have regular levels of vitamin B12 and vice versa. So vitamin B12 deficiency anemia will have low vitamin B12 but regular iron levels. And this can be also used as a way to differentiate between vitamin B12 and iron deficiency anemia. And thank you.